All right, ladies and ladies and gentlemen, it is 5 o'clock. Quorum is present, so the July 27th meeting of the Nantucket Board of Health is now open. Just to remind you all that this meeting is being audio and visually recorded. Do I have comments from the public on any item that is not on the agenda? Hearing none, we'll move on to review the minutes of June 22nd. Those have all been distributed. I have one comment on the section where we gave the Health Department authorization to do variances on food trucks. It mentions the list of criteria, but are those to be attached?
No, they just have to be listed in the minutes.
Yeah, so I can provide an attachment to that.
I would provide it, because otherwise it doesn't make any sense.
Yeah, we have the attachments in the office, so I'll go ahead.
Do you want them attached?
It'd be, yeah, that's...
Okay.
They should be attached.
Then we should have sent them to me.
Yeah, I'll bring
They should be attached. Are there any other comments on the minutes? You have a comment, Mr. Ray? All right. Do I hear a motion to approve the minutes? All in favor?
Aye.
Minutes are approved. Vote of officers. We're going into the fiscal year. We have 2 reappointments, so we need to redo our officers. Do I have it?
I will move that for the coming year, the officers remain the same, with Dr. McNabb as chair and Mr. Visco as vice chair.
I second.
Any comments, additional? All right, this is my last year. It's time for a break, so I go off the board.
Did you say that last year?
No, I'm going to go off the board. All right, so all in favor of the officers as proposed by Ms. Weld, say aye.
Aye.
So be it. We will move on with the same officers for another year. DPW report?
Yes. So the PPW director has been detained due to some unforeseen circumstances. So he has provided a written update right now, and he is looking to do a full presentation on the landfill for the August meeting. So he did give me the written report, which I will be forwarding to the board as an update. And he's hoping that you can have if you have any questions on the written report, any specifics, go ahead and email him, and he will be happy to answer them at the presentation as well as beforehand. Really quick, as a quick update for the minutes, recently for the solid waste and recycling facilities for the town of Nantucket, the DPW has been taking new approaches to the way certain things have been running. Recently, they've been having some third-party inspections as required by DEP. So one of the things that the DPW director is looking to do is to take a look at those third-party inspections, as well as do hand-in-hand inspections with them, so that he will be able to see the same things that the DEP is seeing. So he can audit those reports and then report back to us. One of the big questions that have been coming on about the landfill is the sewer sludge, the cake that comes from the sewer, and then the compost and the landfill leachate. So one of the things that they've been doing is they recently changed the methodology in which certain things get dropped to the tipping floor. He's looking to create a leachate collection facility as well as on the tipping floor. But one of the things he is doing is he did a full audit of the cell 2A, which is where right now that lined cell is, where they're collecting that leachate. And he looked at their way of taking care of that. And they are pumping it, and he's looking to do a full audit of the new cell that's being constructed. Right now, they're going to weld the 2 cells together to go to the same leaching facility. So none of the leaching fluids get out of the lined cells. And then directly below the composting area, they are collecting the leachate there and putting it through to the same leaching pumps. So every day they do take that leachate, they bring it back out to the sewage treatment plant for treatment. The biosolids that come out of there get brought back to the tipping floor, put into the composter again to make sure that it gets digested again to continue the processing. As a result of that, the the waste options group, they are increasing the purity of the compost product. Right now, that it's not really the most sellable process due to certain things that are going into the compost. So what they've been doing now is actually, due to Rob's experience off island, they're implementing some best management practices. So with the new compost, between the landscape debris, between the compost, things that are coming out of the digester, they're creating the windrows so that they can properly digest through aerobic digestion here. And they're doing the turnover of the piles to prevent anaerobic digestion, which is what creates a lot of these contaminants. And then they're creating a more sellable product. So Waste Options is actually looking into creating a bagged product out of this compost so that it'll be easier for people to just pick up and take out rather than having to come in with buckets and do it as it's always been. So the MRF, which is the Materials Recovery Facility, which is where everyone else goes, he actually had a safety audit done. Some big violations were found. And in that safety audit, he accompanied the safety auditor along with the director of the facility. And they pointed out specific things that needed to be fixed. And they have been systematically fixing all the problems that have been found on the list, including all the what would be considered OSHA violations. So he is looking to have a fully 100% compliant facility with these from the safety audit by, I think he said, the end of September. I met with him today. Secondly, with as far as access and the traffic flow, everyone has seen the videos and have dealt with the traffic on Nantucket Road. So they're working together with DPW is working together with Waste Options to create a way to make the traffic make an alternate traffic pattern so that the people turning into the facility are kind of off the road, off the area now, so that those trying to get to Nantucket Beach, to Millie's, and down to Tristram's Landing, and those areas, they don't have to be held up by the traffic going into the landfill. The Take It or Leave It program is what they're doing is redoing some of the signage, redoing the way things are being dropped off. Right now it's kind of a free-for-all, and things that shouldn't be dropped off are being dropped off, and the town gets stuck with the bill, really, to get rid of that. Things like the cathode ray tubes and mold printers, things like that. So he's looking into finding a beneficial use for that. There are many recycling groups that would take it. So he's looking to find a way to fix that, and he'll present that to you. One of the big projects that he's been working with, the energy coordinator, Lauren Sinatra, and National Grid, they are working on doing safe removals of Freon. So when the old refrigerators and things were being thrown away, before they weren't being discharged, or if they were being discharged, they were being discharged. So what he's doing is they're implementing a program to do safe removal of Freon from air conditioners and refrigerators and freezers and things like that. And then they're restoring all the groundwater monitoring wells, as well as installing a few more. So I was at the facility just a few minutes ago, and they have actually located where the old wells were, the ones that had been buried. And there is a commitment from Waste Options to unbury those and get those wells open and available for testing again. So we'll be able to test that old well that there's been some controversy over about how it had a hit, and then all of a sudden the well conveniently got buried. They are going to unbury it, and it is going to be accessible again. And then they located and GPS tagged all the other wells on the site. So all the systematic testing will be done correctly again. This is all in a brief write-up in the report, and then Rob is looking to come in and do a presentation in August to give you a full breakdown of this.
What we can do is we'll look at the report and then ask the board if they want him to come back. Okay. Because August is going to be a busy meeting. We have a public hearing.
We have a public hearing, and then right after that, we have the MIT
Yeah.
project.
Okay, so now what's the status of the RFP for the new evaluation that Mr. Vesco was involved with?
So, would you mind if I mention it? Okay. So, Stephen has tried to contact Robert. He sent him a message. What was it today? He said, and he's looking to. He's waiting to hear a response right now. So once that communication is open, I'm sure we'll go from there. But Stephen, if you would like to add more.
I would just sooner rather than later.
Yes.
Especially with July of next year coming up fast with the implementation of 51. I was thinking maybe we should actually have a deadline of, when we should have the finalized report of the work to,
Right. We definitely will. Well,
I mean, I would think they could get it all done before, next April's town meeting. I mean, at least.
is that a possible? I mean, to me, that's quite possible. That's a long time from now.
Yeah, it's definitely possible, and the implementation of 51 is in 2 years, not next year.
Fiscal year 2019 is actually
No. It's July 1st, 2019,
not 18.
not 18. Yeah.
It doesn't matter.
No. Absolutely. No. It doesn't matter, and we should definitely get the RFP soon, or at least any reasoning if they're not going to pursue it, which I haven't heard otherwise yet. I do know that the Natural Resources Department has the funding in their budget, and I just haven't had a chance to connect with Jeff about it.
Steve will.
Yeah.
I know.
Keep
it's
on people's
everybody's
tail.
So crazy right now.
It's just kind of.
It's hard to get everybody together. So.
All right.
It seems as if, even though the Shimo Sewer project has been going systematically and going very well, it's taken up a little bit more of our time than we kind of expected this summer. So I feel like if I'm already feeling that it's taking more time,
Right.
I can't imagine where Rob and Dave are right now.
Okay. Well, we'll ask you how it's going
I
now.
think
then.
Cormac has a question.
Cormac.
Thanks, Mr. Chairman. Thanks, Roberto, for the update. Cormac Collier for the Nantucket Land Council. I don't want to make a number of comments and or open-ended questions without Mr. McNeil here because it's not necessarily fair to him. But I did want to say a few things as it relates to hopefully what the Board of Health can do in the coming months, and then just an update in terms of what the Land Council has been doing in terms of Long Pond. As you know, the Land Council wrote its letter to the Board of Health requesting an audit, coinciding with your guys' request in March. Understandably, Mr. McNeil had just come on, so we understand that there is a time period where certain things can't happen with a new employee. But I do want to just remind the board that that was in March, almost 4 or 5 months ago, 4+ months ago. As it relates to pretty much the stuff that we're most concerned about, the water quality contamination, the DPW director has stated that the water quality reports for the wells that are existing are now up on the town website and the DPW, either DPW website or the water quality website for the town. I can't remember which, but I've seen it. It's great. I'm glad they're up. I encourage you to look at the most recent report from January for last year's results. Arsenic, off the charts. Nitrogen is above 10. And then there's a bunch of other ones on a second tier. And these are just for drinking water quality in terms of the tiers, but they definitely give you some cause for concern with bioaccumulation of arsenic in the ecosystem. And then as it relates to nitrogen, we all know that that's one of our significant concerns. That was just for well number 8, I think. Well number 4 is the one that got buried that we really want to see and get. That's the closest one to the long pond. So I'd love to get results on that. In the most immediate term, it would be great if we can uncover that as soon as possible. And I don't know if it's just issues or what if we can't do that, but let's just get out there, do it, get it done, start sampling. It just seems to me that it should be able to be done. Maybe it's an issue with waste options, which I understand that's sometimes difficult waste options. So secondly is the cake. I really think we have to get an analysis of the nitrogen in that cake. I'm glad that he is instituting best management practices for the management of the so-called cake, and then some runoff into some of the retention ponds, and then recycling some of the leachate. But where that end cake product and the compost sits is basically on it's basically on bare ground. Not the stuff that is accessible to the public, but I'm talking about way out back where it's been stored for years because there's so much product. There's mounds and mounds of product, and that we're concerned about the leaching going on there. Thirdly, there's a component that still is missing, and it's DEP oversight. And I strongly encourage the Board of Health. The Land Council will be doing this. We want to work with the town administrations and agencies, but the Land Council is going to be contacting DEP to get further oversight if the boards don't follow up on that action. I really want to work with you guys and get everything back under DEP oversight, so that the administrative consent order that the town originally signed in '98 to get the dump and the composting and the cells, that's reviewed and audited to make sure that they're doing it appropriately, and then also for the rules and regulations for DEP to make sure those are being done accordingly. I trust and have full support for Mr. McNeil. I do want to say that, but I think once he gets everything set and he's comfortable, I think it's very important to get DEP back involved. Finally, just an update of what the Land Council is doing as a service to, I think, the Board of Health and the community at large. We just completed some fish sampling today. We got white perch and eels that we are sending off to the state for analysis. This is the Fisheries Department, not the Waste Management Department, but we've been working with them over the past several months to come up with a protocol and design where now they've looked at the water quality reports, and originally they were just going to do mercury testing, but they saw the very alarming elements that are in those wells, and so they're going to be doing fairly detailed sampling of those eels and those white perch for certain contaminants, bioaccumulation in the fish and in through the ecosystem. We also did sediment sampling as well, so it'd be interesting to see what those sediments turn up as well. Roberto knows that we've been doing this, and we're going to be working with Roberto on the results. Knowing the state, I don't think the results will really come out for another couple months or so, but it will provide the Board of Health with assistance for you guys in terms of the fish catches. And I don't know if anybody's doing anything else in terms of eels or even turtles. There are populations of people on the island that actually catch and eat turtles as well, if you couldn't believe it, but they do. So that's certainly a Board of Health issue. As it relates to the ecosystem at large, I think we can bring in Natural Resource Department and everything else. And again, finally, I'll just summarize. I'm not saying that there's a silver bullet to these contaminants. It's a landfill. It's been a landfill since we all know.
Yes.
So it's not necessarily something that can be done. Maybe these water readings are normal for landfill activities, but I just think that we have to explore all options, particularly as it relates to the nitrogen issue. For some of those. So Thanks again for your progress on it, and hopefully we'll get more progress in August and September.
Well, it's the progress I would like a little faster, so
Yeah.
we won't take the compliments yet.
Okay, thank you.
But make sure Collier has a copy of that report.
Yes, definitely.
Great,
Actually, I
thanks.
can send it
And
to
then
you right now.
I would like to discuss this again. I just want to make sure, well, we'll see what the August agenda looks like.
Absolutely.
Hopefully the public hearing won't be too long.
Can I just have one final comment? I'm sorry, Chairman. Mr. Chairman, there's many disparate groups in Nantucket. All have similar interests with the landfill. And similar to the forums that you're holding tonight, it would be good if we could get, if Mr. McNeil is doing a full presentation to the board at some point, that advertising goes out to the Nantucket community as well.
Yes.
Because there's always, as you know, different points of perspective, and if we can get one central place of dispensing that information, more the better.
That would be good. Well, we'll do that, not in August, but maybe
Yeah.
September. Well, we just had too much to do in August.
August is a pretty full meeting.
Yeah.
Great, thanks for your time.
Okay, thank you very much. We have a loan for 16 Keel Lane.
Yes. So same. It's
Same
same as always. Failed system. Looking to connect to town sewer.
Yeah.
no problem with it from our end.
I can't imagine we would have any problem. Any comments, questions from the board? May I have a motion to approve the loan for 16 Keel?
Motion to approve.
Second.
Further discussion? All in favor of the loan, say aye.
Aye.
Chairman says aye. Loan is approved. Okay, now, Roberto, you said you wanted to discuss marijuana
Yes.
and just kind of update us on all that's going on. And particularly how Health Department, the Board of Health, because I'm not sure we really have any input into this.
So I'm hoping that this one will actually be more of just an update. I definitely want to back and forth, get everyone's perspective on this. So the retail marijuana dispensaries are looking to start flourishing in Massachusetts. Currently, we do not have a local regulation regarding marijuana itself, whether it's medical or recreational. One of the things that we've been running into, especially with some of the medical ones, we have 2 applications on the table. One has already been approved by the state. The other one is going through the application process right now. And we've run into a few issues. Where it runs into with the health department is it's a couple tangential connections and 2 main full-on interactions with the health department. The tangential ones are things like the social determinants issues. Right now we have a no tobacco smoking bylaw, but we don't have a marijuana bylaw. Mm-hmm. So right now you can't smoke a cigarette on the street, but you can smoke a joint.
That's interesting.
Exactly. So it's things, those logistical issues come up where we're going to have to most likely update that regulation to hit all vapor style, because that's the other part too. Some recreational marijuanas are coming out with that new vape oil, so people can actually hide it into their e-cigarettes. So that's one of the tangential ones. The other tangential connections are access by youth. There has been, based on the National Youth Risk Behavior Survey from this last year, marijuana use is up significantly. 41% of America's youth has reported currently smoking or have smoked marijuana by the age of 15. So it's becoming an issue from a health department perspective, from a overall public health perspective. Marijuana is linked to severe cognitive issues when it's smoked by teenagers and developing brains, which is why in Massachusetts the law says 21 and over, but it's still going to be an access problem. In Nantucket right now, we don't have any recreational applications, but right now we have no way to limit how many, which we may be able to do Board of Health wise. Which brings me to the 2 main interactions. The incoming use of marijuana, as we've seen in Oregon, Washington, California, and Colorado so far, has been edibles. So the new way to ingest the marijuana chemicals, both THC and THCA and a bunch of other different types that some claim to have medical activity, has been through the creation of edible teas and butters and whole 9 yards. So one of the problems that we've been discussing internally through administration, between the police department, town administration, and I, is the way some of this is marketed. Retail marijuana has been seen marketed in these other states already as candies. There have been marijuana gummy bears, lollipops, things that are clearly targeted for children. The state laws, to my knowledge, does not prevent that. That's something that we might be able to prevent from a local bylaw. Also, as far as it, because it is edible, it also falls under food. So right now we have obviously the food regulations, but we don't have a concentration regulation. So what it comes down to is what is an acceptable concentration limit. So with recreational marijuana, we're worried about THC, the tetrahydrocannabinol, which is the psychoactive substance that gets people high. Well, some of these concentrate oils that are coming out of Colorado and things have concentrations as high as 40% THC, which, if taken as a full dose, especially by youth, you can actually overdose on this. It does happen because what you're overdosing on is the THC, not the marijuana itself, which is the arguments you hear against it. You hear a lot of arguments that nobody has ever overdosed on marijuana, but they have overdosed on THC, and they are seeing this in Colorado already. And then the another part that we've been discussing with the police department is traffic. There is no way to test active levels of THC in the body. So with a person is driving drunk, you can just breathalyze them and you can check for the BAC. There is no blood.
Are there laws about driving and smoking marijuana?
There is right now. It's the whole driving under the influence or driving while intoxicated.
Okay. But there's no way.
There's no way to test for it. There's no way to prove it. So it becomes kind of a public. It tangentially touches public health again, in the sense that we're expecting, just like Colorado, higher rates of fatal accidents.
Well, yeah, I mean, the problem with testing is there's a very long half-life, so you'd have to really establish legal concentration, and there's probably not a lot of data on that.
None.
So
and
it's a mess.
That's the second big part for us, the testing. So Nantucket is only accessible through federally regulated waters or federally regulated airspace. It is still a federally illegal substance.
Yes.
To be caught with any amount of this through the federal airs or federal waterways will be considered trafficking. And the Coast Guard has already issued a statement that they will enforce the federal laws, which means if they try to transport it to Nantucket via their own boats, not only will the person transporting it be arrested, but the boat will be seized and the product will be seized. And they will be charged with federal felonies. As it's a state law, some of these people are, people like me, master's degrees in public health, and they're thinking they're doing good for the world, and they're getting their lives ruined by getting a felony drug trafficking charge. There are no laboratories on the island that can test for this concentration, for the products, for the purity, to make sure there's no mold in the air, in the plant itself, things like that. So the only way to do it would be to test it off island right now, which is obviously a no-go. And then the next step behind it, which is more of a security issue with police, is some medical dispensaries are looking to do home delivery. Especially the one that's already been approved is looking to do a home delivery, which means the product will be leaving the store not in the hands of the final user. There is a chain of custody form that they're looking to implement, but it becomes a security issue as to where is that product now going once it leaves.
What would be how much medical marijuana would be used? If it's used by law with a certified physician's prescription on this island?
Right now, the medical marijuana law allows for a 60-day supply.
But I'm talking about the number of patients.
Oh, the number of patients is unlimited.
But medical marijuana,
Yeah.
but
It's the same as a pharmacy. They can have 100 clients. They can have one client.
right. But what's the demand going to be? I guess I'm not asking the question right.
What is the demand on the?
Yeah.
I actually don't know. There is off island. We've been seeing with the ones that have already been implemented, like in Brookline, we've been seeing that people are now getting medical marijuana prescriptions because they've rolled their ankle. Doctors are just frivolous. Some doctors are just frivolously.
That's a physician issue. 'Cause
Yeah, some physicians are just giving these prescriptions out. There is a specific physician that I spoke to and worked with in Framingham, who they would call him Dr. Cannabis, Dr. Pot, because you just showed up, said my shoulder hurts, and he would give you the card, because he believed that everyone should have access.
But I think you're wondering, like, what's that use going to be once these? And the only way to really tell is if you went to a town of our size, like in Colorado or in Washington,
Yeah.
and saw what the increase was.
But as my understanding, I mean, not every physician can write that prescription. You have to be, if I remember the Massachusetts law, you have to have the physician has to be certified to be able to write it.
I believe so. Yes.
So I don't want to get into details of medical marijuana because we'd be here all night. The point, I guess, when will the law become effect in Massachusetts? And in other words, what's the date when the first shop will open up?
For medical marijuana, the law's already in
Yeah,
effect.
but I mean for non-medical marijuana.
It is already in effect. It has. It
Right,
is.
but there's been a delay from the
They-
legislature.
But the delay was only for the 6 months. The law is in effect. But what the Attorney General has, because no applications have been approved yet,
Yeah.
the Attorney General has allowed for towns that are looking to seek another moratorium, a further delay. They have to have a vote by their town meeting or city council, and in the AG's office by December 31st. By April 1st, which for our April town meeting, it's after April 1st. So that's why we have scheduled the fall town meeting to discuss
Right,
this
because
moratorium.
if we're going to have any kind of bylaws from this board and like them done before
Absolutely.
and not afterwards, then that's just not fair to the owners of these shops.
Yeah.
To make the rules after they're already here.
Yeah.
So we do have some need to get going on this.
Yes, we are definitely under the gun on this. This kind of crept up on everybody. We expected that the state law was going to have specific rules and regulations for how the retail facilities were to run, and they didn't. The State Department of Public Health has not come out with regulations, and they're not expected to come out with regulations anytime soon. So they have left it to the towns.
Isn't there a commission that they've appointed, a 5-person commission?
Yes, they did appoint a commission. To my knowledge, they just met for the first time, but I haven't seen the results of I haven't seen any minutes or anything. It hasn't been sent out.
Well, I mean, we do have this week. We have to probably rework the smoking regulation or put it or a separate regulation. Or can we shoot for September to have a public hearing on this?
We can definitely shoot for September. Let me put that
It'll
in.
take some work beforehand to decide exactly if we want regulations and what kind of regulations we want and what can we legally blah 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 blah.
Yeah. Yeah,
I mean, the fact that we can't smoke cigarettes, but we can smoke marijuana, we need to deal with that.
Yeah, and one of the parts, and Art, you have some comments on this, but one of the parts that I've been thinking of too is with that regulation, the medical marijuana actually also is allowed to dispense the marijuana plant to you as well. So in the smokable form, which is not really what was expected. So it's kind of surprising.
I mean, there's a lot of issues here and a lot of things to think about. Will we be ready by September?
For the smoking regulation, the
Yeah,
open
we
smoking
can do
regulation,
that.
we can probably get that done by September. For a larger retail product regulation, it might take a little bit longer.
We have to do that before there's a store here.
Yes. So far, there is no applications.
Okay.
So we're still okay. And if town meeting does accept the moratorium, we can push it back the town will be pushing it back by another certain amount of time. But we still need to get it done before any of that comes in.
Well, let's shoot for a September public hearing on at least amending the smoking regulation.
Mm-hmm.
And then some comments from the audience.
Yeah, just maybe a question. I thought the law allowed for, legalized marijuana, but not in public areas or public places.
Well, we have to look into that. I mean, maybe when we do our homework, we won't have to do anything, but let us anticipate that if we have to do something, we'll shoot for September, but in the next 2 or 3 months, we'll do our homework and figure it out.
Art is correct in that it's not allowed under the Massachusetts Smoke-Free Workplace Law, which is considered public places, things like that. But we do still need to do our local reg because it still allows for like transient. So somebody who's
Because ours is town property.
Ours
public
is town
spaces,
property or
et cetera,
public
et cetera.
space.
Beaches
Exactly.
and so forth.
Yeah, unfortunately, it does kind of exempt things like that are owned by the town.
Mr. Ray has a comment.
I understand that the Board of Health has no jurisdiction over medical marijuana. That can exist in most communities.
That's correct.
However, does the board not have the right or the ability to write a regulation that simply says there shall be no recreational marijuana distribution sites within a given town?
We actually asked that to town council, and the answer was no, we cannot ban it.
See, I'd asked that to MHOA and a few other health places, and I got the word yes, we could. So maybe that needs to be
Interesting.
Wow,
further
yeah.
reviewed. I think
It's
just say
even-
no.
Yeah.
Well, maybe, do you need some help looking through all of this stuff?
It would be very helpful.
I would volunteer myself as a subcommittee of the board to look into it.
Okay.
At least go through it. Anyone else? As long as we don't have 3 of us. We can't have 3 of us, then it's a meeting. Help. So maybe Helene and Art and myself, and we'll have a little subcommittee, and maybe sit down next week for half an hour, at least plan what questions we're going to ask. Something like that. I'll send a note.
Sounds good. Yeah, it definitely has to be a much larger discussion.
Yeah.
It's the recreational use is going to be it's a bigger freight train than we're expecting.
And the medical marijuana, I mean, there are some people that definitely are benefited. However, there's a lot of misinformation in the medical literature. It's not even the medical literature about
Yeah.
it. So,
Do we have any information like small towns in Colorado and places out there that you could get a hold of town ordinances that they've implemented in small towns that they have?
I can definitely get the information. I don't have any with me right now.
No, but I mean,
but-
it's possible to get something like that.
Okay. Yeah, I'm pretty sure we can, especially through their health departments. And
yeah,
I can reach out to colleagues.
our little group will do what we can to decide
Mm-hmm.
if we need to do anything, or maybe we'll just,
Yeah.
everything will be let everything go as it is. Any other questions? Anyone in the audience want to comment on this subject? Okay. Now, the next item is the meeting time I put on the agenda. Just want to get your input, is if we held our meetings perhaps at 6 o'clock. It goes into our dinner hour, but it might be easier for more people to attend our meetings.
Yeah.
Because we've traditionally been at 4, and, some people are still working or...
So have you had any requests to change the time?
No, I just opened for discussion.
Okay.
I don't know if it would increase our participation. I mean, we're not the most popular board on the island. I don't know, Steve.
No, any time is
Well,
fine.
you know, we could change the next 2 or 3 meetings to 5 or just 6 and see what happens.
And see what happens.
Yeah, well, the next one, we have the presentation at 6 by Kevin on his mice project. So we should still probably meet at 4.
Yeah, it's
4:30.
looking to be 4:30 is still the best time because of the public hearing on the IA system regulation. And even if we end a little early, we can still. I'm pretty sure that Kevin's group will need some time to set up and. So
Well, then the TV people are going to be in here.
exactly.
The Nova people are going to.
Yep.
Those of you who don't know that the PBS Nova is going to start following this mice project, so they will be here. Well, we'll see how it goes. Maybe the September meeting, we'll discuss it again. I'd like Jim's input to it,
Yes.
too.
Yeah. Yeah, and then the Board of Selectmen's meetings are at 6 on Wednesdays. They get some pretty good attendance. The Conservation Commission is
Everyone else is at 6.
is at 6, but they get about the same amount of attendance as we do. It's usually just for something that affects the person that's
Of
on
course.
the board. But definitely, it's something we can
All right,
definitely
we'll
do.
think about it. I don't hear any great objection to it, but maybe...
Or maybe we do 5 for regular meetings and 6 for public forums, something like that.
Yeah, easily.
Something like that.
Sounds good.
Well, next month we'll have to adjust depending on to get everything done by 6.
Yes. And I think we will be able to get everything done by 6 next month. It's just, it always, just like this meeting, the variance requests that had come in,
They're all gone.
all of a sudden got pulled back at the last minute. So our meeting went from being an hour and a half to 45 minutes.
45 minutes.
Um,
Okay. Any other things we want to do? Why don't we do the director's report?
Yep.
And then we'll start the forum at 6.
Yeah, so we have the forum actually posted as a separate meeting, so we would have to adjourn this one and then reopen a new meeting at 6.
So let's go on and do
Yeah.
your
So-
report.
So as of right now, the summer has been going very well. I was looking at the numbers today. Hank has just been out there killing it on fertilizer. The numbers that were collated were 90 inspections in June for fertilizer between you and Natural Resources. And then July so far has been a significant amount.
How many
Do you-
violations in those 90?
Do you want to?
Yeah.
Sorry to put you on the spot.
No, I think what we've done is we've tried to get out in the field and be out there on a regular basis. We haven't had very many violations, but I think that's because it's changed somewhat. We're more proactive. We go out and I do get a hold of every landscaper I see and take the time to talk with them and make sure they come off the property and to us instead of me walking on the property. And so that's been helpful. And I think the landscapers have changed somewhat in that some of the landscapers have reduced the number of people who are out spreading fertilizers and have limited it to just a small group. And those people have their license and they understand what's going on. And they're more willing to talk to you and say, is this okay, or are we doing the wrong thing? The larger landscapers know what they can do,
Right.
and the people who are using the product are very knowledgeable. So I think it's changed a lot since the first year. And so we, instead of just looking for people with large stockpiles of fertilizer in the back of the truck, I make sure that I go to every landscaper and
Good.
say, what are you spreading? What are you doing? Let me see your license. Or even if they don't have product in their truck, I say, I'd like to see your license if you have one. Or do you spread fertilizer? And most of them do not now, and they really have just a few individuals that do that, and they are definitely licensed. So I think we've eliminated some of the problems. It's certainly, we still have a long ways to go, but I think the brochures and the advertisement on the radio and just the interaction that we've had with from our department and from natural resources really have made a significant
Good.
effect on what's happening.
Right. So it's educational.
Yes, absolutely, and I
Inspection.
think that's been very helpful.
Yeah, absolutely. And I'll touch up on some of the work that we've been doing on the forum in a few minutes.
Okay.
The whole first section is on fertilizer.
Good.
But it's definitely been helpful. The Land Council, Cormac's gone. The Land Council held a forum last week as well where we discussed water quality. We've been getting good feedback about that. And we've heard one or two comments about some of the things we can do better, mainly about, once again, the gray water issue got brought up, but some of the mooring questions about the chain and the mushroom mooring versus the bungee type. But all in all, it seemed to be very effective, and people were pretty happy with that project. Right now, we have been working very hard this summer. I've had interns and myself have been working hard on this, and we are very close to the completion of a community health assessment to identify some priorities in community health issues. And we have also been doing some internal strategic planning. So once we do one of the public groups for strategic planning, Malcolm, you should be getting an email from my intern really soon to set up part of that group to go over the skeletal outline of our strategic plan. It should lay out the footwork for the accreditation process. So as some of you know, the hospital already did the community health improvement plan. The three main portions of accreditation process is the community health assessment, the strategic plan, and the community health improvement plan, the CHOT chip and the strategic plan. Once the strategic plan is done, which hopefully we should have that done by December, we should be set for accreditation. And then comes the process of collecting the information and then the application at the next fiscal year. So we're really happy to see that.
Well, I'd like a strategic plan and focus.
Yep. And I would
we kind of tend to do things as they come up, not in any planned way.
Exactly, and
Yeah.
it drives me a little crazy.
Right.
So hopefully this strategic plan will set priorities over the next few years.
Good.
And then that should be it right now. And then I have to switch chairs with Helene if that's okay, so that I can control
We'll take a break and do the form. Any other any questions for Roberto? And I like meetings without all the variances too. Right?
Yes, that's what we're hoping to move forward to.
Yes, we can just give them all to you. All right. We're going to get to that someday. All right. If I hear no objections, we will adjourn the meeting and take a 10-minute break, and then at 6 o'clock start the forum.
Sounds good.
How's that?
Perfect.
So the meeting is adjourned, and we'll start our community forum at 6 on our new regulations.
Is there any difference in the people that the company that sign for the laws? Whatever you want. Yeah.
And so, you know, I think I said something to him when they were about that. I said, some of the people you should talk about that. I said, because, you know,
Oh,
and I said, you know, it really does affect everybody.
right.
We didn't want it, we wouldn't handle it.
Yeah.
Now it's too hot. Now it's too hot.
Because I'm sure
But I know, but it did change. We're not just used to it. It did change. Yeah.
Right.
So maybe. Oh, it does? Oh, then we just acclimated. Okay.
No, because to me the hall was not cold.
Okay. Yeah.
I got the hall to warm up.
Oh,
They're
yeah,
tough.
that's what I mean, it was freezing when we got in here.
Well, it was freezing. I don't know if it has to do with
I know.
the whole system.
No.
I said 85.
I know.
No, they're pretty nice people too. But, you know. Oh yeah, they are. But, you know. Yeah. Right. Yeah. Yeah, there you go. Yeah, when you got time to listen, right?
Uh-oh.
Right. Yes. Oh yeah. Yeah. Oh yeah, you're right. Yeah. No, no. Oh no. And the thing is, They just assume put the right stuff down, the wrong stuff. They don't. Yeah. Yeah, they're just doing the job. And if the guy said, here it is, put it down, that's what they'll put down. Yeah.
I was out at Loins last night. Your partisan was getting, there were over 200 people.
Where's that?
Loins Observatory, the March from where I live.
She should have told me. I would have
Yeah, no,
come
I
and
mean,
cleaned it. You
That's
know?
right.
they were getting, I mean, we were there on the early side and then left a little before 9 at the open night, I
You weren't
guess.
interested in
People were streaming in. I mean, it's
Usually
good for them,
they'll
yeah.
call me saying they have something going on there, which I
Okay,
didn't
all
hear
right.
from them.
Right, the last thing you wanted to do was cut your break.
Regina.
Oh, I know, yeah.
You know, that's down at Mariah Mitchell in the main office that runs everything down there.
And what did she say?
Jason?
Jason.
Okay,
Yeah, Jason
yeah,
the finger, right?
Yeah, right.
Usually she'll
let you
let me
know?
know
Okay.
because I've done stuff
You don't have to try to
at the
vote.
buildings
Okay.
and stuff before. And then when they have an event, she'll say, "Oh, we're having something tomorrow night,"
Yeah.
but I never done it.
Oh, okay.
I would have
All
just
right.
made sure it was on a plane because
Yeah.
they'd sit in there for a while.
Little did I know.
But they had a lock
To me
on
from
it.
the outside.
Yeah, they had a lock on it, so nobody could come
lock.
off the street and use it.
No law.
Yeah.
Okay. 6 o'clock. All right, ladies and gentlemen, will you take your seats? All right, well, this is sort of an extension of our meeting today. We thought it would be a good idea, and it was suggested to us that we update people on some of the various new regulations that the Board of Health has voted on in the last, say, 2 years. I love to see all you here. I wish more of you would actually come to our meetings when we do vote these things in, but you're here, and that's important. So what we're going to do is Roberto will go through, basically summarize, and do you want questions while you're speaking or questions at the end?
It would be best if we do questions at the end.
We'll do questions at the end when he's finished, okay? And you all know Roberto Santa Maria, who is our health director. Yep. And we're your Board of Health. Jim Kelly also sits here, but he's on vacation. Roberto.
Okay. Sorry, I'm getting over some allergy issues. So thank you for coming to the Board of Health Regulations Forum. This is probably going to be the first of an annual regulations forum, just so that we can do a quick year in review from now on, from all the activities of the Board of Health over the past year and how it affects you as homeowners, renters, people with interest to the island. So let's just create with some background here. So a lot of the regulations that we've passed over the past 2 years have all had to do with the watersheds, both Nantucket Harbor watershed and the Nantucket Harbor watershed. So the two issues that we've been the main issue that we've been looking into is what we call a nutrient load. Nutrient loading is the same concept as maybe. And I don't have access to the back room. Is this any better? Is this any better? I can just bring it any closer. Does that work? Okay. All right. So the main issues that we've been looking into is what's called a nutrient load. A nutrient load are things like nitrogen, phosphorus, and potassium that enter. So the same nutrients that help us grow and survive as human beings also help plants grow and survive, and algae and other bacteria. So when you get too much of these nutrients entering the water in an estuary environment, like almost all of Nantucket is, you can get overloads of algae blooms. So the main contributors to nutrient load is septic systems, fertilizers, the landfill, stormwater runoff, not necessarily in that order. And then runoff and groundwater can affect potable water as well as recreational waters. So one of the things that we've been seeing is that statewide and nationwide, these nutrient loads have had an increase of blooms, decrease of environmental quality in all rivers, harbors, ponds across the coastal communities of the United States. Specifically in Massachusetts, we've been seeing loss of eelgrass beds here in Nantucket. We've seen a significant reduction of eelgrass. We will see decreases of oxygen concentrations. So in general, there's a lot of oxygen in the water. However, when you have an algal bloom, a large algae bloom, like the one we're having in the northern section of Hummock Pond right now, what you see is kind of this green scum layer at the very top. That is the algae that's blooming due to these nutrients. The algae in and of itself isn't always dangerous. However, what makes it dangerous to these water bodies is that it sucks up all the oxygen available in the water. And because the sun is not penetrating and it's creating a layer between the air and the water, more oxygen is not dissolving into the water. So this decrease of dissolved oxygen can actually create fish kills. So you may have seen some pictures from the algal bloom in Florida last July where they had the algal bloom, and once they started skimming off the algae, large amounts of dead fish were floating in the surface on top of that because they literally suffocate due to the lack of oxygen caused by these algae blooms. And then as also as a result of these algae blooms, they kill off a lot of the natural flora and fauna that's there, allowing for a lot of invasive species to grow. So we want eelgrass to grow. We don't necessarily want seaweed to grow. The seaweed grows in a nutrient-dense environment. The eelgrass does not. So as a result, we're seeing as the eelgrass recedes, the seaweed fills in that empty areas. So we get a decrease in this diversity in our water. Next, please. So the first step that we took, approximately 3 years ago, there was a passage of the Regulation 75, which is our best management practices and the use of fertilizer applications on the island. So where this goes is that this requires all people on the island, renters, homeowners, landscapers, to follow the best management practices that we have. We have a BMP document that we created over, the town of Nantucket created over a period of many years, worked together with the Article 68 work group, which Mr. Ray was very instrumental in setting up from the beginning. And this document is available in both English and Spanish. It specifically sets up how much nitrogen, how much phosphorus, how much potassium can be placed on garden beds, on turf, on bushes, mainly because things such as what is called fast release nitrogen, which is a nitrogen that is easily dissolvable in water and can migrate easily. That's been one of our biggest issues with overload in fertilizer. So what the BMP requires is actually a 75% mixture of slow release nitrogen, which means that it's bound by something. It is not water soluble, so it stays in location, and the plants use the nitrogen as needed. Next, please. So from the fertilizer regulation, we've actually increased some of our fertilizer enforcement, which I will go over later. But as that is just one part of our overall wastewater management and our water management plan, we created the Regulation 64. Regulation 64 was actually one of our older regulations passed and we updated it in 2015 to require innovative and alternative systems, which means that if you are within the Nantucket Harbor watershed, the Great Harbor watershed, you are restricted to 110 gallons per day per 10,000 square feet of land, which means that if you have a 20,000 square foot lot, you will only be able to have 2-bedroom septic system. Whereas without this regulation, if it was a basic Title V, a 20,000 square foot lot with an IA system would be able to have 3 bedrooms based on that nitrogen calculation. And then all the failed systems within the watershed, which we mean by failed is that it fails either technically or hydraulically, which I can explain in just a moment. All the failed systems will need to upgrade to an innovative and alternative system. And if they are within a sewer area, they must connect to the sewer within the 6 months if they're within the watershed, or the 24 months depending if you get a variance or not. So what is the difference between a technical and a hydraulic failure? So a hydraulic failure is the failure where the system is either leaking, so the tank is leaking and it's not providing separation of any of the sewage that goes into the tank, or there is situations where a component of it is crushed due to a truck driving over the distribution box or your sewer line, and you end up getting backup. So if the leach field is clogged, for example, sometimes that the hydraulic pressure from the hydraulic load, that will push out, and you'll see breakout and ponding of raw sewage actually on the surface in the grass. That is what we consider a hydraulic failure. It's backing up into the house, it's backing out of the system, the effluent's not being treated. A technical failure means that it fails based on a technicality, a technical part of the law. So in the nitrogen-sensitive areas, such as the harbor watershed, the wellhead recharge district, what that means is a septic system needs to have 6 feet of groundwater, 6 feet of separation to the groundwater, because most of our ground here is sand, which means that the effluent goes through it really quickly with very little purification. So as a result of that, the effluent from the septic system enters the groundwater quickly. So if you're below the 6 foot separation, we consider that a technical failure. The IA systems are also required in this area upon new construction, upon home property transfer, and upon any sort of operation and failure, any sort of renovation and failure. Next, please. So why should we do an innovative or alternative system? So the state of Massachusetts specifically tests and defines what an innovative alternative system is. The IA systems are proven to reduce the amount of nutrient load by a minimum of 50%. And that is, some of the systems have well exceeded that. Sorry. So reducing that by the 50%, we are already minimizing the amount of nutrients entering the harbor. That, coupled with the 1 bedroom per 10,000 square feet, if it was a regular Title V system, when you have a 20,000 square foot lot, you can have 3 bedrooms on that lot if you had an IA. This regulation does not allow that. So we have an overall minimum reduction of 66% of nitrogen entering the harbor. And then the IA systems also require operation and maintenance agreements, which we track through the Barnstable County Health System. And the operation and maintenance agreement, what that does is makes sure that the system is working properly. Right now, if you have a basic Title V system, you get your inspection. That tells you your system is working, but it doesn't necessarily tell you how strong the effluent is, how much flow is going through it. With an operating, and then that's only done every few years or so. With an operating and maintenance agreement, an IA system is constantly tracked. It is tested twice a year to make sure that the effluent is reaching the standards and that it is properly removing the nitrogen and the other nutrients from the sewage. Next, please. So most recently, I know I realize that I'm going through these relatively quickly. Please, when we do get to the questions, please feel free to ask me to go back to any slides, and these slides will also be available online, and I can definitely provide them to the Civic Association so that they can push it out to you in your emails as well. For the Local Regulation 51, most recently in February, we held a series of public hearings, and in that public hearing, we felt it necessary to pass this regulation that emulates the Nantucket Harbor watershed. So some of you may know that there was a push to get sewer in the Nantucket Harbor watershed area, which did not pass this past fall. At the ballot, it passed town meeting, but it did not pass at the ballot. So as a result, we had to think of next steps. So we do realize that effluent is still entering the harbor, effluent is still getting into the groundwater, and we're still having the nitrogen problem whether we have sewer or not. So the sewer is a way to remove all of the effluent, but coupled with, as the voters have spoken, we have to find a way to lower the effluent, as the nitrogen load, as much as we can. So what we did as the board, we held a series of public hearings to discuss the possibility of emulating Regulation 64, but recognizing that the town administration and the Board of Selectmen may want to pursue sewer in Nantucket again. So what we did is we voted in the regulation. However, we are holding it in abeyance until July 1st of 2019. If at any moment between now and 2019, July 1st of 2019, the sewer is voted in, that this regulation automatically becomes, this section of the regulation automatically becomes null and void, which means that because sewer is coming out, we're not going to require you to put in a new system just for you to have to tear it out and connect to the sewer. It's unjust, it's unfair, it's not something that we want to, a burden that we want to put on anybody. So this one is perhaps one of the more, this was definitely the second most recent regulation that we've passed. This one is almost identical to the harbor watershed regulation. Next, please. Coupled with this regulation, the next public hearing over the course of February and March, we held two public hearings regarding wells. One of the things that came up in our discussions about sewer and where the water quality issues are, we decided to do an audit of our files about water, drinking water and potability standards in Nantucket. So in that, we did an audit of over 100 of our files, and in that we found only 78 completed well reports, and some of them are as old as 1994, which means a well can be contaminated or a well can change between today and next week. So a well report from 1994 isn't necessarily valid anymore. So we decided, we as in the staff decided to pursue a testing procedure, a way to gather data and see where we stand on primary drinking water contaminants. And as a result, we decided to pursue Local Regulation 68. By way of background, just to explain here this chart, the MCL is considered the maximum contaminant limit. The MCLs, what that means is that it's a number set by the Department of Environmental Protection as what is the maximum level of drinking contaminants that can be in a drinking water that can be allowed without it being detrimental to your health. 80% of all the water wells that we took, of all the samples that we looked at, had at least one MCL exceedance. Most of them, a good amount of them, were due to saltwater intrusion. So they are exceeding based on sodium levels. And then most of them were exceeding mainly because of pH levels. a pH level that is too low or a pH level that is too high in drinking water isn't necessarily dangerous to your health in and of itself. However, if it is sitting in the pipes for a day or two, it could be leaching some of these metal ions out of the pipes that you have. So some of the houses on Nantucket, which are definitely, most of them are older than 50 years old, which is pre-lead laws, some of the pipes still are made of lead. So if you have a corrosive water, both too high or too low, it could be leaching some of that lead into your drinking water. We have been seeing some copper etching, which you'll be able to see if you take a bath, for example, you'll see the blue staining on bath, or you'll see blue or green staining in clothing. That is called copper etching, which if you have copper pipes in your house, a pH that is too low can corrode some of the pipes, and those copper ions will end up in your drinking water. Why is that important? Copper is known to cause gastrointestinal distress, and if you have young children or if you're pregnant, it has been linked to some degenerative issues among children. Next, please. So the Board of Health adopted the regulation. Mainly what it is to prevent people from drinking contaminated issues. We're not trying to force this issue on people. We're not going to be coming after you with a stick and fines. What we're looking to do is for people to systematically test their wells, provide us with the data from that certificate of analysis so that we can put it into our database and start doing this, a scientific review of what primary drinking water issues we've been running into. The regulation is requiring that people test their well every other year. There has been discussion that maybe we should do that every 5 years, once every 5 years, which makes sense, and it is possible that we will open the regulation for a new hearing so that we can fix that. Right now, the way we're implementing it, this regulation was implemented on April 1st. The way we've been implementing it is we just finished as a staff getting a database together, a tracking database, and we will be systematically contacting specific groups across the island to get a representative sample. So some people in Fisher's Landing will get an address, a letter addressed to them asking them to test their well. Some people in Tristram's Landing will get water to test. Some people in Pippin's Way will be getting a letter to test. People in Sconset, people in Tom Nevers, Cisco, so that we can get a representative sample around the island. If we do see some areas of concern, we may open up that level to test more houses in that area. All of this data will be publicly available in our office. We are not trying to hide anything. What we're trying to do is just get a grasp over some of our drinking water quality issues on the island. Next, please. So just by way of background on the wells, the reason we want to test this is that wells tend to pull their water from the immediate surrounding. These water wells can get easily contaminated from, if the well cap gets broken, from being hit by a lawnmower or a lightning strike, things like that. Sometimes people have put their compost pile right over their wellhead without realizing it, because sometimes people don't know how to recognize it. It looks like just a little metal pipe sticking out of the ground with a cap on it. If it's not, sometimes they're not labeled that this is a drinking water well. So some people have just put compost there. They've done motor oil changes there, even though it's illegal on Nantucket. We have seen over-fertilization, issues like that. So some simple things can actually contaminate the well. And many people might not even know. Just anecdotally, about 2 weeks ago, we had somebody come into our office who just heard about this, tested her water, found out she had coliform in her water. That is easily repaired through a decontamination of the well. But like she said, who knows how long this contamination had been there? It could have been years from when one of her pipes burst and the plumber came in to replace the pipe. So it's more than anything, it's for people to recognize what it is that they're living with, get a better understanding of their water well, and really kind of take control of their own health. So next, please. So the main portion of what we do as a health department is we try to push the education. The town website, the Nantucket Health Department website, you'll see on the top right, it's pretty small right now, but we have links that say healthy community, food, water quality, home and environment. What we have done is we've created specific web pages in those links that link to everything from air quality, mold, lead, food access issues, mental health access issues, things about well water, things about their septic system. You can find all of these brochures and educational information out there. We are currently looking to create a series of one-pagers, brochures, and PSAs that we can start pushing out and getting out to the TV stations as well as online and through that we can push out through your civic associations as well. We also push out a lot of our information via social media. We do have the health department has a Twitter handle, which is @healthdepartment on Twitter. We also have an Instagram account that we push information out. We do push the information out on Facebook as well. The town of the main page of Nantucket, if you go to the nantucket-ma.gov, at the bottom there is a section that says Notify Me. Notify Me is a system that we use to push out email blasts. So if you click on Notify Me, you can sign up for email blasts specifically for Board of Health, for Planning Board, for Conservation Commission, Board of Selectmen, anything that the town does. So whenever our public information officer pushes out information, you'll get an email saying there's a new agenda on the board from the Board of Health. There's a new agenda on the Board of Selectmen, or the Board of Health, or the Board of Selectmen, or Concom. They're having specific meetings, things that would interest you. We did push out, for example, the flyer from this out through that Notify Me program. Next, please. So overall, as far as enforcement goes, this last fiscal year, which went from July 1st of 2016 to June 30th of 2017, we have actually performed a significant amount of inspections and enforcement issues. So we've had, in FY17 alone, we had 415 fertilizer encounters. We call them encounters because they're not necessarily complaints or enforcement actions. We have two people going out right now, one from Natural Resources and Hank from our health department here. They go out and they meet with our landscapers as they're placing fertilizer to make sure what they're putting down, how they're putting it down, who is putting it down, and if they're licensed, to make sure that they're meeting the BMP and making sure they're meeting the regulation. We have also licensed 463 commercial fertilizer applicators. We have held a series of trainings every year. This last year, we changed it to from a video-based training where people just watch a video where it was very high level and most people weren't necessarily understanding it, to a actual skills-based training where we met with a series of landscapers. We trained them how to calibrate a spreader, how to do the calculations on how much nitrogen and how much phosphorus is in specific fertilizers, and then how to apply it in a systematic fashion so that you don't accidentally over apply fertilizer. The videos for that are being currently edited and will be available on the Town of Nantucket's website and the Health Department's website, hopefully within the next few months. Yes, sir.
Maybe it's my age, but I can't even read what you have listed out there.
I didn't realize that this was actually going to be so tiny.
Well, increase the volume of the
Yeah. Yeah. Can you hold Oh, it won't let you? Okay. I don't know. I honestly don't know how to make this bigger. Let me see if I can. Yeah, unfortunately, let me see. There we go. Yeah, it's a little bit hard to see. Is that a little bit better?
Yeah, not much.
Not much.
Front light.
Yeah, the lights are in the back. Just a moment.
To add to this immediate discussion right now, it is very rewarding to know that now that you're out from under planning and land use services, inspections are increasing. Nicely done. Thank you.
We've the overall numbers is in the thousands.
Yeah,
of
in the
inspections.
last couple of years, it's gone up. My question is with Regulation 78.
Yes, sir.
Could we go back to that slide?
Okay.
I want that one. I understand the exceedances down the bottom. They're certainly there. My concern here is that what can really the town of Nantucket do about it? Not much that I can see. Meeting or exceeding sodium contaminants. You're going to find that's probably mostly coastal stuff, mostly in the Nantucket area, Sconset, places like that do have private wells still. And you're not going to change that. The only thing that's going to remedy that is putting a reverse osmosis system or town water. Town water has stalled in Nantucket, certainly, and you're not going to see it probably go anywhere else. The corrosive pH, I don't see the town changing that at all. That simply means that somebody's going to have to either cut down pine trees or put more lime on their property. I mean, that's an answer to that. My other concern is this well testing. The town is paying for all of this, correct?
No.
Oh, no. They're not.
Richard, you know that.
The homeowner is, right? I guess the rub for me is if we find a problem that really is a public health issue, that is really a defined public health threat, and you see them on the mainland. You certainly see the Monsanto issues. You certainly see Dow Chemical issues where you've got a known pollutant source. We're seeing it over in Forestdale on the Cape from the base there. We don't have that issue here, nor do we see that number here. I think the water testing concept here is a little excessive and may not be as warranted as we think it is. We've had great drinking water here. Cancer rates on Nantucket are actually going down. People tried to pin that on nutrient loading and a few other things. I just have a concern about this one, and I think it's an extra burden placed on a property owner. My other concern is to do it in, as you said, in small sections in areas and exclude other areas. If you're going to do it, you got to do it for everybody. You can't just pick an area and go, this is where we should do it. I just don't think you should do it at all. Thank you.
Duly noted. And yes, the way the water testing is done, we're recommending once every 2 years. On Tuesdays at the Board of Health, before 9:15, you can bring in your water sample. It is $45 to the Barnstable County Laboratory and $5 to cover shipping via the High Line. And then the cost of the little bottle that you can pick up at any of our Nantucket pharmacies. That is the cost burden. It is not necessarily a large burden to consider the health. And we can make arguments regarding cancer. We can make arguments regarding sodium. And yes, understood that the town may not be able to fix that. But the first step in remedying any situation is knowledge of that situation, whether the burden lies on the town or on the homeowner. So one of the other parts that we're worried about, too, is nitrates and nitrite contamination. If you go to the town of Nantucket's website, the health department's website, under the regulations, you will see a background letter that I wrote. In there, I do explain how these recent studies regarding the nitrites and nitrates in well contamination at levels of 5 milligrams per deciliter have been found to increase the incidence of cleft palates by about twofold. At levels of 10 milligrams per liter, they have seen a 3 or 4 and up to a 4-fold increase in spina bifida. The maximum contaminant level for nitrates and nitrites is 20 milligrams per liter. It is really a pushed out maximum. It was a minimum regulation set by the state. They call it the maximum contaminant level because past 20 milligrams per liter, you start getting into major health issues beyond just the regular chronic issues for children. So it's, as a person who, on a personal note, as a person who is hoping to create a family, I would like to know what is in my drinking water, especially considering the people who will be drinking it. So if we can go to that last slide.
And I think in a year or two, once we have a lot more data on this subject, we can address the issue by altering the regulation,
Yes.
if necessary.
Can we wait till the questions slide?
Yes,
Richard?
let him finish, and then we'll do the questions.
Thank you. So we had 463 licensed commercial applicators on the island. The list is available at the Natural Resources Department if you would like to know who is licensed, and if you would want to make sure, if you're a landscaper or if you're thinking of hiring a landscaper, to make sure they're licensed. This last fiscal year, there were 947 septic inspections. These include permit inspections, abandonment, witnessing of inspections, and percolation tests. There were 341 IA systems permitted and tracked on Nantucket Island. So far, we have achieved a 100% compliance rate on our O&Ms. At this time last year, we had about 10% non-compliance. We were able to track all of them down. And I do applaud Artel Crowley for personally tracking down every one of them. There are, as of the most recent data that we have, there are 96 technically failed systems in Nantucket and 25 hydraulically failed systems in Nantucket that are in various stages of repair and permitting, which means permits may have been issued already or they're being in the process of repair. There are 18 technically failed systems in the Nantucket Harbor watershed and 14 hydraulically failed systems also in various stages of repair. The non-water quality related inspections this last fiscal year, we have had 675 food inspections. We had 290 housing complaint inspections, 34 camp inspections, 25 pool inspections, and 3 tobacco complaint inspections. So this is all being done by a staff of 4. So as you can imagine, there is a significant burden to our inspection program, but we are in the process of systematically repairing a lot of, not repairing, but systematically taking care of a lot of these complaints and a lot of the issues here. And as Richard pointed out, the inspections have definitely significantly increased over the last year or two. And I applaud Hank, Kathy, who could not be here today, and Art in just really, really getting out there and making sure that this work gets done. So next slide. So with that, we have the questions section.
I hate to keep looking like a Pop-Tart here. But, and I guess I've got a question for the chair. Sewer to Nantucket has always been a hot potato, at least for the last 3 years. It's been up and down and up and down. Is there any concern at this point from the Board of Health of proposing an article to reinstate sewer to Nantucket?
Well, the chair has repeatedly said the solution to most of these problems would just sewer the whole island. And so I would certainly favor the sewer in the Nantucket.
Thank you.
My name is Jim Schilling. I and my family have been summer residents of Nantucket for, I think this is our 34th year. I've always been a great supporter of the Board of Health attempts to both control effluents and also water quality. I'm familiar with the new Reg 51, which was mentioned, and I certainly supported the one that was approved in February of this year. But just in the last day, I received an email from the Nantucket Civic League, and attached to that email was a substantial change to Reg 51, which made it drastically different from what was approved in February. I haven't heard any comment on that. Is that something that's not going to be discussed at this meeting?
They got it wrong on that page.
There are no proposed changes to what was passed
Where did
in
that
February.
come from?
Whoever filled out that page on the Civic League had some things wrong on it.
Yeah, we have no intention of altering 51
Okay.
right now.
So there is no new Regulation 51?
No.
No, just the one that was passed in
Okay.
February.
Thanks.
Anyone else? Please, Ken, come on down.
My name is Ken Bogrand. I've got two questions. One with respect to the water. As you know, you've talked about testing all the wells and everything like that, but we have a delivery system for our water that in some instances is 100 years old. And as we've seen in Michigan, very often the delivery system is through lead pipes, which in fact has delivered a lot of lead into the homes of families. And I'm wondering who has the responsibility for testing the quality of the water that is being delivered by the water company through the water system that we're all drinking? Is that the Board of Health or is that the water company, and what's being done in that regard?
Because it is a public drinking water supply, the water company is testing that. And we have seen in the past few weeks, actually, the water company came into our office to test some water that's coming out of our pipes in the health department right in town. They do systematically test, to my knowledge, just to make sure, like what you said, that there is no leaching in there because it is of grave importance. I know they have tested at the schools, at every school has been tested. They've tested at water fountains, the public water fountains. They've tested at public facilities to make sure that we are meeting proper standards and that we don't get a Flint situation here. Bob and Mark have been really good at staying on top of that.
Excuse me, in your defense, there are several houses on Main Street alone that are serviced by lead services going through the wall into the service on Main Street. So you have got a point there. I don't know if the water company is testing those, but there are plenty of houses on Main Street and in town that are serviced by lead services right from the main in through the foundation into the house.
Yeah, and so my question is whose responsibility is that, and then to make sure that if we are aware of it, that we in fact correct it.
If the lead pipes are on the private property, it is the private homeowner's responsibility to repair the lead. If it is the public water supply, then I believe it is the public water supply's responsibility.
Roberto, our director for the Water Comment is here if you'd want to answer any of those questions.
Mark Willett, Wanna Comment Water. We do sample for lead every 3 years. We take over 60 samples at different locations, and we actually have to pick. The DEP mandates that we pick those age houses when there was lead pipe and lead solder used. And because we have a very favorable pH in the groundwater that we're pumping, we've had no hits, nothing above required limits.
Well, that's terrific. Yeah. The other question I had was with respect to the AI systems, and I was wondering whether or not the standards that are being implemented by the Board of Health are state mandated or locally mandated, because as you're aware, the AI system is from 150 to 200% more costly to install than a historically other system. Apologize. And also, as you explained, it is more restrictive in terms of the number of bedrooms that you can have. And so I was just curious as to where that came from, because in fact, that tends to be a tough economic burden on the individual property owner that has to go through that process. And I'm really happy to see that you're not implementing the thing with respect to Nantucket, because in fact, you are implementing it in the other areas out in Pulpus and whatnot, and it makes it very difficult because the homeowner has to put the system in, and then when the sewer comes in, they have to scrap the system and then connect to the sewer.
You can go and then I'll comment.
Okay. So the IA system standard, that 50%, and then the bedroom counts and things like that, those have all been defined by the state as Title V. What we did with our local regulation was restrict it a little bit further by adding the 1 per 10,000 square feet and requiring it at renovations or failures or things like that. That's the main part of what we did to make it more restrictive. We created the requirement. The state does not require them. We did locally.
It is more restrictive, but as far as individuals who put in IA systems with anticipated sewer, I think we've given variances to people who in the short term are about to have sewer put in, and we have kind of an, I guess, call an island-wide variance that you actually have 10 years from the time you put your IA system and the time you have to go on sewer, if sewer comes to your door.
Okay. Thank you.
So we try to take that into consideration.
Right. Thank you.
Yes, please.
Good evening. I'm Charlie Stott, and I'm speaking this evening as co-president of the Nantucket Civic League, and I'd like to offer a clarification. The Civic League did send out a notice of this forum to its mailing list, and subsequent to that, an individual redistributed that notice and attached 3 documents to the notice. One was Regulation 51, the second was Regulation 78, and the third is the draft proposed edits in blue italics of Local Regulation 51, which I assume that individual may have found on the Board of Health's or the Health Department's website. So it's an old amendment that maybe should be taken down if it's still live.
If it's still there, because the original 51 was significantly altered by the time it was actually passed.
Right. I'm very much aware of that, and I appreciate the alteration. But I just wanted to clear the air that the Civic League did not send out this false information.
Thank you.
I will check, but make sure that the draft is no longer on the website.
If you want to speak, just why don't you come on down.
Bill Greeter, Nantucket resident. First on the reg that we were just talking about, for quite a while the stale document was on the website, which was the draft, and I contacted Roberto on a weekend and he took it down. My guess is that there are a lot of people that have been following this issue that grabbed that draft document, and in all honesty there's quite a few draft documents that are still on the website. The updated documents that have been passed and become policy haven't been updated, so somebody could go on and find them, and if they don't call the office, they're going to be all upset about an erroneous document.
One of the problems I've found is if you go into the search part and say put in 51 or some key, you'll actually get a whole stack of documents.
Yeah, well, I mean, this
not
particular
the
one,
actual final one. So
this
that's
particular
something.
one I know for a fact was a stale document.
Roberto will fix that for you.
Yeah, I'll have to. I'll have to
The
go
question
through all of them.
about that well testing, a couple of things. Is there a fine involved in the current policy, the way that it's written?
I think there's a fine now, but I don't think the health department is going to be enforcing anything till we get some information.
So, well,
Correct.
exactly, that's what I thought I had heard.
Yes.
So, and I don't doubt that Roberto's comments about concerns for different diseases and stuff is anywhere inaccurate. I would come forward and say, if there is that concern, then rather than looking for voluntary compliance, I would think that the town's really trying to get compliance, and the only way you're going to do it, you're not going to get it by asking people to volunteer. We went down that slippery slope with septics, and it's been years and years, and people just ignored it. The other thing is that the Board of Health obviously is concerned about things and what's going into our waters and bodies and stuff. What is the Board of Health's position on the testing or lack of for other things that are coming out of the landfill into the ponds? The neighbors, we've been promised over a year ago that the town was going to start testing for other things.
Right.
And quite frankly, we haven't seen bupkis. Every time we call and ask about it, we're told it's still in the works, still on the drawing board. It's a year later. We've had all of this contaminant going in.
I think the Board of Health has been pushing for that information, but I'll let Steve and Roberto
Thank you.
answer that question about where the town is in that process. Because obviously, well, I won't give a personal opinion yet. Go ahead.
So as of right now, the town is testing. There is a third-party compliance testing, and the new DPW director has been very diligent in getting those publicly available. I don't have the information with me in front of me, but he is making the reports available, and I know the Nantucket Land Council has the reports on their website. I will have to check with Cormac to see where that is. But they are testing. There is a current push for adding things to the testing and changing the style of testing. And that's where we are, where we've been trying to push for more information. And I know that there is some money set aside to get that testing done this year. Steve, if you would like to add anything.
No, that's it. We just before everybody showed up, we were talking about it earlier, sooner rather than later, and it's happening. So hopefully we'll have those results shortly.
But I think the Board of Health is very concerned about what's coming out of the landfill, and we're pushing hard to get as much information about it as we can.
Good evening. My name is Bob Cook. I'm a part-time resident of Nantucket, and I face out until Long Pond. And I guess I didn't hear the gentleman's question or comments, but nothing is being done about the pollution emanating from the landfill into Long Pond.
So there, right now, just from the best management practices, they are trying to prevent as much pollution as possible. There was some practices that were being done that were definitely, I wouldn't say necessarily detrimental, but a little not the best management. So recently, for example, to prevent any silt runoff into the wetlands, there has been new fencing and silt fencing put up to prevent that runoff into the wetlands. They've rebuilt the berm in the back that had been breached, so there's no longer any leachate runoff into Long Pond from that specific retention pond. The compost leachate is being collected in a new way now, in an impermeable membrane, to prevent that runoff from going down into the pond. They are working within the confines of what they have already, just trying to increase the practices before any complete overhaul is done right now.
I have noticed since I've been here only a week that I haven't seen any bloom in the pond this year. To recognize as a Board of Health that problem will only get bigger the more that you dump out there, and that the ultimate solution to that is shipping it off island, as I believe Martha's Vineyard does. So, thank you, and good presentation tonight. It's appreciated.
Thank you.
Please.
Leslie Forbes, Nantucket resident. And if I've heard it once, I've heard it 400 times, that the solution to our nitrate and nitrite pollution will be a multifaceted one. We've talked about fertilizer, talked about cleaning up septics. And I think the dump is the piece that is the most egregious in Nantucket. And you're doing some things, but before we spend $80 million on a problem, I think we need to understand what's driving the problem. And I feel like we're jumping automatically to the sewer solution before we know what the dump is contributing, and also acknowledging that the water quality is improving with the work that is being done. So I don't think we should be silent on that. Thank you.
Thank you.
Hi. Hello. This is a little high for me. I'm Janie Hobson DuPont. I live in Nantucket. I'm a retired teacher. I have a few questions. You said there were 4 contributors to the pollution, and you weren't sure about. One was fertilizer. Yeah, that would be good, because I don't remember all 4. That would help me.
Yep.
Oh, right there. Yeah, fertilizer, septic, landfill, and stormwater runoff. And you said they were the 4 main contributors, but not necessarily in that order. Do you have an idea of the order?
So the Comprehensive Wastewater Management Plan and the Massachusetts Estuaries Plan, which has been a highly controversial document over the past few years, actually sets the order as septic systems number 1, the landfill as number 2, fertilizer as number 3, and runoff as number 4, with septic systems being approximately 40 or 50% of the pollution, and the landfill being about 27% of the pollution.
I'm sorry, who said that?
The Massachusetts Estuaries
Based
program.
on what?
They have a series of models that they've run it through. That's what makes it so controversial. It's a proprietary formula used by SMAST, and I can't think of the acronym right now, but it's through UMass Dartmouth.
So it's for all of Massachusetts, not for Nantucket specifically?
It's the model that they use from all of Massachusetts through comparable landfills. They don't have an exact information from the landfill. What they do have is information from average load, from amount of septic systems, the amount of fertilizer that is being done. But it is unfortunately a best guess.
Yeah. So I'm a little confused, because you know how Nantucket is. We hear things. We hear things in the market. We hear things down at the boat landing. And I heard that there was a meeting. It was a selectmen's meeting, and there was a report about some water testing that had occurred around the dump, and that it was very bad news. Now, I don't have any specifics, and so I feel a little vulnerable coming forward, yet this is the place to bring it up.
Absolutely, this is the place to bring it up, and thank you for letting me know. I honestly don't remember a Board of Selectmen's meeting where a water quality report about Long Pond or any of the groundwater around it was reported, and that it was bad. We do a water quality update every few months. I believe it's every 6 months to the Board of Selectmen. Something about water testing may have been said at that point, but honestly, I don't remember anything being brought up about it being bad, about it being really
well,
bad.
I think it was brought up because the Board of Selectmen, they felt whoever did the testing, and like I said, I don't even know who did the testing, but it was being brought up to the Board of Selectmen because they anticipated that it would cost Nantucket so much money to rectify that. So that would be really good if we could, you're the person to definitely find out about that.
Yes, to my knowledge, an estimate of how much costs to remediate never came out, but the third-party tester that does the water quality testing and tests the wells that are around the landfill is a firm called CDM Smith, and those reports are all available on the town website under the landfill section under water quality.
Oh, good. Good. Then it should be public, I guess. And so then I've also heard from different people, I mean, I'm the person just saying what I've heard,
absolutely,
that the state, the Commonwealth of Massachusetts may come in and say, well, Nantucket, you have to install these sewers. What's that about?
Yes. The Massachusetts Estuaries Project, the MEP for short, is actually a review of all the estuaries, the major estuary bodies in Massachusetts. And through that project, they set specific, what's called a TMDL, total maximum daily load of nutrients that can be released. And it is set up as a preliminary enforcement document. So
what is that?
So what that means is more that to use some mariner's parlance, it's a shot across the bow. It's saying, we have found these problems. You must meet your TMDL within an X period of time. They didn't give us a specific timeline because we are making significant progress towards it, one of them being the Nantucket Harbor Watershed regulations and things like that. So we're making progress to meet our TMDL. So the Department of Environmental Protection has actually just taken a side seat and just is watching at this point. But they do have the capability and the capacity to come in and tell us, you haven't made enough progress that we find satisfactory. You now have to you now have to build sewer in 2 years.
So you think it's your best guess that as long as Nantucket appears to be making progress in the right direction, that the state probably will not come in and mandate?
As long as we're making significant progress, I can't speak for DEP. However, as long as we're making significant progress, there are other estuaries in the state of Massachusetts that are in worse shape, so they're greater priority right now. But we are still on their list. It may push it back. We may buy ourselves some time, but it is still borrowed time, and we do still need to meet that TMDL threshold that they set for us.
Okay, I just have to look at my notes.
No, absolutely.
Just remember that TMDL is a guideline of where we should go. When people talk about our waters getting better, yes, it is getting better, but the TMDL is probably higher than it should be. If you compare it to other fresh water or other unpolluted waters, we're about twice what I believe we should be, but that's the state target.
That was another thing I wanted to ask. So I've heard about water quality, like in Long Pond and also Hither Creek and Nantucket Harbor, getting better or getting worse. Can you be more clear about that? How much has it gotten worse, or how much has it gotten better?
Absolutely. The way when we do our reviews of this information, there are specific testing stations across Long Pond in down Nantucket Harbor, down Hither Creek into Nantucket Harbor. I don't remember the exact number of how many stations there are. So some stations in the lower end of Long Pond are actually increasing in quality. So what we've been seeing is
You mean getting better?
getting better. Yes, getting better. So we do see some stations going up. Other stations are still going down, even in Long Pond and Hither Creek, just because of concentrations and the way flow happens. So Long Pond is, for example, one of the ponds that we do not open. We open Hummock Pond. So when we open Hummock Pond, the lower end of Hummock Pond, their water quality skyrockets right after that opening.
You mean getting better?
It gets better. Yes, it gets way better. But even up at the head, because that flushing hasn't gone all the way up, sometimes that water quality doesn't get better. Sometimes it just stays stagnant, which is some of the things that we've been seeing in Long Pond, where certain stations are reading better quality samples, where some stations are still reading low or lower water quality standards as certain things get diverted or not enter the harbor at that point. So all in all, the general trend that we've been seeing is that yes, the water bodies are getting a little bit better, but they're not getting better fast enough, or they're not getting better to the point that we would get DEP off our backs about it.
And just remember, we need better quality, even better than what DPD says we should have. So that's a target for us. But I don't want us to get lulled to think if we get to those standards, we're somehow done.
Okay, thank you.
I'm Greg Ross from the Hummock Pond Cisco area, and I have a question about the watersheds. The A and B zones were established by what study, when, and then is that I've heard it might get revised. We looked at
That goes back a long time.
Yeah.
Maybe.
Yes, the original study was done by the Horsley Witten Group, and to my knowledge, there is no intent to hire a private independent group to do it. However, there is currently a process by the U.S. Geological Survey. So once they are complete with that, some of that information may alter the watersheds. It may not. It may solidify it to where they are now, or may even shrink them or even grow them. As more data becomes available, the more information we can make available. But until that information comes to us, we can't make any decisions.
Yeah, do you know when you would expect to learn about that?
No, I don't have that information on hand right now, but as soon as we get it, we'll pull it out.
Okay. I just had one other question. If you're within the watershed, it said in the regulation, it said if there was if somebody did a renovation project, if you do a renovation project that doesn't affect the number of bedrooms, doesn't affect your existing septic system, you still have to put an IA system in?
And
Art is our resident expert.
We just went through this.
Yeah.
In some cases, it will. If your new construction definition, the way it reads, our local definition states that it's additional square footage requiring a certificate of occupancy. So it's very broad grabbing. So in some cases, if you're going to change the footprint of the house and add on, it would require it if you didn't have or meet the one bedroom for every 10,000 square feet of property.
You can always ask the health department for a question, and you can always come to this board for a variance.
Yeah.
If
Okay.
it's because
It seems like it's. I can see if you're adding bedrooms or you have to move the system or something.
That's a
like
little iffy. So
All right.
if you had would be open for discussion on a particular individual case.
Okay. Thanks.
A previous questioner was asking about a water quality presentation that was made to the Board of Selectmen, and perhaps what she was thinking about was Jeff Carlson from Natural Resources coordinator did a presentation about a proposal to test the well water in, I think, around 8 wells around the perimeter of the landfill.
Yes.
And I guess I guess my question is, has this happened, and if so, what are the results of those tests, if you know?
Steve, Ted.
CDM Smith, they test every year. I think there's a report on the one that I saw last year was of 2014 of the 8 or 10 water wells, surface wells, and actually some of the old gas wells they tested. And the report's pretty detailed and long. If you can interpret it, and it's not good.
Well, I think this was something that was to have been done this year, I believe, and I somehow remember maybe $35,000 allocated for it.
Yes, there's a
more than that.
Yeah, so the Natural Resource Department has a $40,000 line item to look into testing different nutrient levels in those same wells, different contaminants, and then through the current contract at DPW, that was also they have a little bit of extra money in their line item to also increase the amount of testing that's being done there. The natural resources money, I think, is going to be bid out, which is a discussion that we've all been having as part of the board here, which we're still waiting for where that bid is going. But the one that is done through the current contract through DPW is CDM Smith. And those reports, as soon as we get them, we put them up. We as the town. We put them up on the website, and I believe the Land Council has also been putting up on their website. So what we have up is the most recent data that we have.
Okay, thank you.
Is all the testing being done by one laboratory?
Right now, the only third-party group that we have, the question was for the people on home is all the testing being done by the same lab? As of right now, what I know is yes. The same group is doing all the testing. CDM Smith is the consulting firm that's doing it.
Please.
Excuse me. Let me just go back to this question before, having to do with changing the number of bedrooms you can have a lot. If you have a 4-bedroom house on a 20,000 square foot lot, and you have to put in an IA system that, as I understand it, is 10,000 square feet for each bedroom, that kind of tells me that it's going to go from a 4-bedroom lot to a 2-bedroom lot. Is that correct?
That's actually a great question. That's a great question. So the yeah, no,
we often
absolutely
have dealt with this.
Yes, it's something that's been coming up, and thank you for asking that. Actually, so the question for the audio is: if you have a 4-bedroom system on a 20,000 square foot lot with a 4-bedroom house already on it, do you have to reduce the amount of bedrooms because it's 1 per 10,000? The answer is no. You are grandfathered in. You are allowed to keep your 4 bedrooms.
The next thing would be, but also to trigger the change is if there's a sale, and you could sell a 4-bedroom house, then go through the IA change and discover that you bought a 2-bedroom house because you can't have 4 bedrooms on it. Is that a scenario that can come to fruition here?
No. Once a 4-bedroom, always a 4-bedroom. If you already have the system in place with the 4 bedrooms being used, you will keep that.
You might want to render that explicit. That's got a huge economic
Yes.
consequence somewhere along that. And one other quick question, not to be argumentative here, but I want to clarify the statement that you made, is that upon the failure of the sewering project, and directly as a result of that, you initiated the Article 51 work. Is that a correct statement?
It was always a next step. That was always the plan B that had been discussed.
Was that an explicit next step, or was that a oops?
Oh, it was an explicit next step. That had been, the question was, did we initiate the Regulation 51 change as a result of the failure of the sewer? The answer is no. It was always Plan B. It had been discussed in many Board of Health meetings before then. So even at the October of 2016 meeting, if you watch the audio, you'll see where when we endorsed the article of sewer, we specifically said if sewer does not pass, we need to discuss these alternatives, being IA systems or other types. So this was always the Plan B going forward.
In the sewering that was approved and passed, was IA Plan B for that as well?
IA was actually already in effect for the areas that the sewer has already passed. So that's where we initiated, due to people discussing these issues with us, the Board of Health granted the 10-year variance for everyone who already has an IA system because it is unjust to force to put in an IA and then 5 months later to have to connect to sewer. That's a no-go on our, it's economically unfair. So the IA systems were already in effect in the harbor watershed.
In the harbor
areas.
watershed, that was 2 years, goes back to Richard's time.
Yep.
Well, your predecessor, Richard Ray, a lot of us put in new septic systems. Richard Ray said, here's what you need to go do. We did that. Now we have to go do something else. Kind of moving target here. So that's what I'm trying to get some understanding. All not to be argumentative. I mean, Richard Ray said, here's what you guys need to go do. We did that. Now we've got something else that we need to go do.
I think from the board's perspective, you can be argumentative if you want to. It's quite all right.
It becomes different as the players change and the rules.
Well, one thing we've tried to do since the board has come into play, I remember years ago there was no separate Board of Health, it was all the selectmen, is to be as consistent as we can, to try to make sure that if we have a precedent, we stick with it as best as we can. And you're always welcome to come to this board for a variance, because as we said, we sometimes get things that are a little, whether new construction or renovation or a system that you just put in yesterday and someone wants you to put in a new one the next day, we'll listen to those arguments. Richard.
Yeah, with regards to that, this is a reach, should sewer be mandated finally for Nantucket? Is there not, within the regulations, a grace period for those individuals who already have alternative design technology systems in place, so they are not put in a bind where they have to immediately give up their alternative system and put in a sewer line?
No, we have I think about 6 months ago or just before the sewer vote, we voted you have 10 years. If you have put in an IA system and the sewer appears in your street, you don't have to take your IA system out.
And that takes the burden off of a lot of individuals.
Yes.
Also, that hasn't been noted here is the fact that there is a loan service out there through the health department where these systems and or sewer can be, you can get a loan to put these in.
It's 2% interest for years. Yes. Yeah. So it's no, you don't. You have to.
Sorry.
No, it's fine. Thank you for mentioning that. It's important. Any other questions? Comments?
I live in Nantucket, John Chauvel, and I would like to bring the audience and the board back a year to June 2016. And there was a meeting here one afternoon, Thursday afternoon, I believe, at 4 o'clock it started. Mr. Santamaria was here. In the corner of the lady was your town engineer, the head of the DPW, Jeff, what's Jeff's last?
Carlson.
Carlson was here. Libby Gibson was here. I don't know whether any members of the board were here. But the whole thrust of that meeting was the eelgrass in Nantucket Harbor. It's dying. It's dying. We ought to do something for the eelgrass. My goodness. And Mr. Santamaria, you raised the issue about your own desire to have a family about spinal bifida. What is the incidence of spinal bifida and blue baby syndrome that you raised in an article in the paper June 1?
I don't have local incident data right now, but I can definitely look into it.
How about other waterborne diseases in our population for the last 10 years?
Once again, that is data that hasn't been collected, and that is part of the information that I've been
Are you
working.
saying to me that the 74 water tests that you have available, there was no any indication of any waterborne diseases? That's in effect what you've admitted.
That is all HIPAA compliance. I cannot pull specific data on a specific person in a
it's never
specific time.
You don't know whether or not there's ever been any waterborne diseases from the wells tested in Nantucket.
Not specifically, no.
I don't think we know that.
Thank you. I think your suggestion about testing our water is a solution looking for a problem. And I think you have the burden of proving that a problem exists before you ask the taxpayer to provide the money provide the solution to your question. So if you take my advice, get some money from the town for testing, offer it to the people in Nantucket, bounded by.
Well, it's not just Nantucket; it's the whole island.
Well, Nantucket is the one who's under the gun here.
No, the whole
It's
the well
is the whole island.
the well regulations are for the whole island, not just Nantucket.
But you're aiming to go again for sewers for Nantucket, even though you got voted down last November. Additionally, I would like you to put out in public the names of other labs that would be acceptable to do water testing. Just a little bit to my view, you're trying to maybe make sure you get the tested result.
Oh, I don't think that's.
That is not true.
That's fine. I'm just saying, give us a choice.
I have a property management business, and I have all my clients, 25 of them, 15 of them have wells, and every one of them have tested, they're well tested at several different places.
And any laboratory.
I don't use the same person to test everybody's wells.
And
the town is using one place.
They're just making it convenient for the town is making it convenient for you.
If you
have the water test done on island right here, all you have to do is get the bottle, do the thing, leave it to them, and they will test it. They don't say you have to take it. You can have it tested any way you want, as long as you provide them with results.
Yes.
You come out and name some other labs that you could use.
Yes, you can use the Barnstable County Laboratory directly, which is the one we use. You can use GNL Laboratories and Virotech. I know.
Put it on your website, please.
Yes,
Okay.
we would be happy to put things on the website.
Sure.
We'll put that on the website.
A year ago, never anything specific. We're going to take care of the folks in Nantucket. If you get sewer, you're going to have these conditions that you'd be able to maintain your system. Now, an A1 or what is it, AI system? That's an alternative?
Yes.
That's not a normal system, right? I'm one of those people that replace my septic system under the regime that Mr. Ray organized, and I have a brand new system. I've tested it, got to have it tested again. What consideration I get if you get another vote through at a town meeting and through another election that I'm not going to have to bite the bullet?
You will have 10 years.
10 years. And that's not with an IA system, that's with any system.
That's just with an IA.
That's with an
That's
IA.
just an IA.
If you have a regular system and you have sewer, then you have sewer.
No, I have a septic tank
Yes.
and fields. 5, 6 years?
If the sewer comes, it's mandatory hookup. There's no.
So I'm out of luck.
You're out of luck.
And what I learned last year at this meeting was the town engineer told us that we would have to fill in our septic tanks and systems, eliminate it completely. Ice going.
That's just a matter of public safety. We can't have voids in the ground. You know, it's a public safety issue. Leaving a tank in the ground is a hazard.
Okay. Are there comments or questions? I just thank you for coming, and again, as I said before, I encourage you to come to our regular meetings where we're actually discussing some of these things before we vote on them. It's a lot easier to hear people's opinions before than after. So thank you again, and we'll do something like this probably every year. And all meetings are on TV. That's correct. I forget that. Please tune in. Thank you.